Guys, Dr. Oshori here, and I wanted to go over a few good cases that I think are helpful on Reddit. This is the series of answering your medical questions. I go through Reddit and I save the ones that I think are useful, and so let's go through it. Here's the first one, and it is gut detox and worms. It is from Gut Health subreddit, and the question is how to do a gut detox and do a deworming. I'm not 100% sure I have worms, but I think everyone does, and read that it's healthy to get rid of them. Any thoughts? So, probably the first thing to ask is, what's the reason that this person wants to get rid of it? If you want to get good, helpful, useful answers on these platforms, such as Reddit, it's important to ask the right questions. It's important to offer the right amount of information so the people with a lot of knowledge in gut health can be of help. So if a person wants to do gut detox, it might be because they are what we call a hypochondriac individual, or somebody with health anxiety is the term that we use, and they're just worried. They want to get rid of any bugs that shouldn't be in their system. That's very understandable. But of course, they also have a lot of anxiety about it, so approaching that person is in the right way is important. Another thing, it might be that this person has a lot of diarrhea, nausea, vomiting, bloating, gas, and they want to help improve those symptoms. So I'm 100% sure if I have worms, but I think everyone does. So let's talk about that. Does everybody have worms? It's actually not true. And worms is considered an infection. So if you do have any kind of worms, it's probably an issue. However, it is normal to have a lot of parasites. Parasites are a normal part of the human digestive system. Some parasites are normal, some are pathogenic or abnormal. Many viruses and many bacteria are perfectly normal to have in our system, and they're very necessary for the skin, the eyes, the brain, and many other organ systems, even the joints, which we thought back in the day were aseptic, meaning they have no organisms whatsoever. They actually do. But certain organisms can get out of control. And for example, a good scenario I bring up is when you see advertisements on certain teas, detox teas, and even Listerine, like an over-the-counter product. It says it kills 99.99% of your bacteria. You don't want 99.99% of the bacteria in the mouth to disappear, because the good bacteria actually help prevent the bad bacteria from overgrowing. And so it's always something to keep in mind. I'm not saying Listerine is bad, but do be aware of the concept of killing a lot of your bugs. So what do people say? Gut health practitioner here, I wouldn't approach parasite cleanse on your own. I take my clients through some prep work before we cleanse parasites. And this is the exact thing here. They're saying they're probably asking a lot of questions before doing something. And even before that, I do a symptom analysis to determine if parasites are a big problem. You are right, though, everyone has parasites. So I think that's what that person probably meant, is parasites versus worms. They typically live symbiotically in our bodies and can be helpful, acting as a cleanup crew. They can also become a problem when overgrown. That begs the question, why are they overgrown? Exactly. So let's understand first why we have a certain overgrowth of maybe even E. coli, salmonella, shigella, or other toxins in our body before we try to just eradicate it. So it's a beautiful answer. Speak to your doctor. So I think this seems like it got downvoted. Speak to your doctor is not very effective answer, because we want our patients to feel empowered to actually do things on their own. We don't want them to feel that they have to always run to the doctor. Of course, this is an opinion that is not shared by everyone. I'm a family medicine physician. I'm a MD. I'm a medical doctor practicing in California, and even in my, let's say, circles, there are many physicians who believe that no, everything should be run by a physician only, not even a PA or nurse practitioner, definitely not a naturopath, definitely not a chiropractor or health coach. And that is fine. I think there should be many ways of us being able to approach health. But in this situation, my opinion is that the people should be empowered, and they should be able to ask these kind of questions and get some guidance and direction. So the next one I have is vitamin D blood test, not covered. This is under health insurance. It's got 63,000 members. It says, I had my yearly physical, and the doctor ordered blood tests to check levels. Blood work billing came back, everything covered, but the $243 vitamin D test stating it wasn't medically necessary. I have low vitamin D levels. How can I maintain check that without a yearly test? Is there any way to bill recode that would be covered, or am I just stuck paying for it? Okay, so if you did get a test that it ends up not being covered by insurance and it was already done, unfortunately you are stuck paying for it. Yes, that is a fact. As far as the vitamin D test, it is not $243. Most vitamin D tests are around $12 to $30. So why is there a $243 charge? And the reason is that the medical group or the laboratory will bill your insurance $243 and even sometimes $500 or thousands of dollars for a certain blood test. However, the insurance company gets to decide how much they're actually paying. And there is a current trend in healthcare, it's been going on for a couple of decades, where the insurance company will bill, the medical group will bill the insurance company, or the lab will bill the insurance company $100,000 for a service that they're only going to get paid $10,000 for. A classic example is an ICU stay. If you stay in the ICU, the intensive care unit, for a week, the hospital might bill the insurance group $750,000. The insurance group knows this, the insurance company knows this, and they're only going to pay about maybe $25,000, $24,000. And that's fine. The hospital knows this, and they just bill a lot to get a lot, and then they can write off some loss on one part. There's some complicated financial situation going on that I probably don't even understand. However, unfortunately, if you don't have health insurance and you end up at that hospital in the ICU, you're going to get billed that $750,000 if that's what the ICU wants to charge. And so then the hospital may negotiate with you, or they might sell your debt to a company that's going to still say you owe $750,000. So in some sense, it's not very good for the consumer, and this huge divide between what the insurance is willing to pay and what the hospital is going to get and how much they're billing is what creates this lack of transparency in healthcare. So going even further out, why is their vitamin D test being done? So we know that this person has low vitamin D levels, and so generally there is really good data to show that checking for vitamin D will not change your outcome. If I know that your vitamin D is high or low, the only thing I can say is that people who have lower D levels, vitamin D levels, tend to have certain other outcomes. But we don't know if it is the actual vitamin D that is causing it. Why is that? Because when we've done other tests, replacing the vitamin D levels and bringing that person's vitamin D level back to normal does not change their outcome significantly. They still end up having some of the complications of whether it's increased risk of infections, fatigue, or autoimmune diseases. Unfortunately, it seems to still stay there. Therefore, supplementing with vitamin D levels based on current research does not seem to be an effective way to change any potential negative outcomes of vitamin D, of low vitamin D. However, what can you do if you have low vitamin D, or what can you do if you're worried about vitamin D levels? The data shows that exercise is very effective. The diet that you have is very effective, and getting proper sun exposure without too much sun blockade is important. Of course, we want to control some ultraviolet rays, but we don't want to completely abolish it. And so using too much sunscreen or wearing completely head-to-toe clothing on cold days where you don't get any sun exposure has been shown to decrease your absorption of vitamin D, especially with certain skin types. And certain foods seem to help you absorb more or maintain more vitamin D levels, or help the kidneys process the hormonal milieu that needs to happen for you to have proper vitamin D levels. And certain foods like alcohol and processed foods might be depleting your vitamin D levels. So those are probably better ways to manage your vitamin D as opposed to kind of chasing the vitamin D level on blood tests. So looks like the answer here, a lot of insurance companies have stopped covering vitamin D ever since the FDA or CDC or whoever it was decided in their infinite wisdom that there is no medical proof that measuring vitamin D levels improves health outcomes. So this is true. Measuring vitamin D levels does not improve your health outcome. In fact, measuring a lot of things in the body, including many blood tests for inflammation, may not change your outcome, because the things that you'd have to actually do to change those outcomes are quite complicated and difficult. However, we can say that measuring your blood pressure and measuring your cholesterol levels do have good outcomes, because we have solid treatments that we've vetted Once the person's blood pressure is actually lowered, that lower number does directly translate into a lower risk of heart disease. My insurance still covers it. Okay, next one, you might need more specifics on why it wasn't considered medically necessary for my insurance. The doctor must include low vitamin D as a diagnosis code. That is true. Sometimes the way it is diagnosed in the doctor's office can be the reason why it was denied. So, for example, if the doctor doesn't put the ICD code of low vitamin D levels, your insurance is going to deny it because, say, the doctor just did a screening test for vitamin D. That's not adequate. But imagine the headache involved of contacting the doctor and the doctor willing to change the diagnostic code. It's complicated. I'll let you guys read the rest, but this is health insurance, and the title of this was vitamin D blood test not covered. The next one that I have is, should I take one more contraceptive pill if I throw up 90 minutes after taking the pill? Okay, so let's talk about contraceptive pills for the sake of contraception, assuming, of course, we don't have a lot of information about this person. It says, if at 9 p.m. taking 2 pills and then I started drinking at 10:30 p.m., too much drinking, suddenly so vomiting, in this case, should I take another pill? In general, because birth control pills are not that dangerous and they're not very high dose of hormones, I recommend that my patients with any intestinal issues, whether they're having diarrhea or vomiting, and if they throw it up within the first couple of hours of taking it, that they just take another one to be safe, especially if it's meant for contraceptive control. And then after that, you'll have some sugar pills. It might throw your next batch of pills off in your case, in the case that you have for your pills, but that's the general consensus. Now, the question, of course, here is this person using it for contraception or for other reasons? I think the guideline is that if you are sick or have diarrhea within 3 or 4 hours of taking a contraceptive pill, take another one. Great. I didn't even know there was a guideline, but that's really good to know. If you're sick within 2 hours, and I think with sick they mean that you're vomiting, so that's really good. Read the pamphlets that comes with your pill. It contains all the information and more. That's good advice. Very few people will keep the pamphlet, but you can actually obtain that pamphlet from the FDA. I didn't know it would include that. That's good to know. Don't have unprotected access until after your next period. So it is true that if you end up in a situation where you missed a pill and then you forgot, or you took an extra pill, or any kind of variation of those pills not being taken properly, it can throw things off in the sense that you may not have the adequate protection. And so sometimes we recommend that if you are sexually active, that you use a condom as a backup method. Good advice on women's health. The next one that we have, and we'll make this one the last one for today. This is at the sub mental health, and this is gay poison. Say, scared I might be developing schizophrenia. So it says, I'm 32-year-old male, suffer from clinical depression and addiction issues, which are behavioral and not substance. So this person's probably not in the US. Seems like they might be UK or Australia. And I am under antidepressants. There have been 2 occasions that I hear things that are not there. Once I was going to bed with my husband, and suddenly I start hearing like a crowd around the room or right outside, and there was some sort of dinner party, lots of people talking and chatting without making anything of what they were saying. I couldn't really make out if it was upstairs, right, left, outside of the door, or it was all around. I asked my husband if he hears it, and he said no. I go out of the apartment and there's nothing out there. Then once I was laying on a couch, I heard my name being called from within my head. It was weird. Then I wake up in the middle of the night, and I start hearing radio cast in the room, something in my head. I could not really make it out. And then something about sport-related, accelerating faster and faster. It was goal, 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 like soccer. And then it went away. I don't know what any of that means. I don't even like sports, so what the fuck? Can anyone please advise me? I already texted my psychiatrist, but it's Christmas. So in general, auditory hallucinations, any kind of auditory sensation that you have that's not real, is considered some sort of it is considered a medical condition. It is something you got to get checked out for. Now, what could it be? Is it schizophrenia? Is it due to the depression that you have a psychotic episode? Generally, when the depression is not very well controlled, you can have psychotic features with it, such as auditory or visual hallucinations. Auditory tends to be the most common hallucinations based on what I recall. And 32 years of age is unfortunately still a time when you can develop schizophrenia, and it is present in about 1% of the population. So it is possible that this person is developing the early symptoms of schizophrenia, but it is also likely that this person is on some medications for depression, and they messaged their psychiatrist or texted their psychiatrist, which is wonderful to see that they have access to their psychiatrist. It's possible that they are having some medication side effects. And it doesn't seem that they have any substance abuse issues, but I would also consider anything from marijuana to drugs to alcohol as possibilities for developing any kind of psychotic issues. So the answers here, being 32 and having schizophrenia symptoms begin to start is quite rare. I wouldn't say it's quite rare. Unfortunately, it's just not something that you can rule out. Typically, schizophrenia will begin to show between 18 and 25. If you've never really had this experience before, you're able to rule out substance abuse. I've talked with your medication provider, depending on your med regimen, and if you're either in the wrong type of medicine or taking several at the same time. Can be overlap of symptom side effects that can lead to hallucinations. All major depressive disorder can have psychotic features sometimes. At first, talk to your med provider. If you have a therapist, I'd talk to them about it too. All great advice, but unfortunately, even though some signs of schizophrenia can develop as early as 18, in fact, even earlier for certain negative features of schizophrenia, usually the break that happens can be anywhere in that kind of 20 to 30 year range, and unfortunately we even see it in older individuals, so it can happen. That is quite relieving. I'm on vortioxetine and topiramate. I had to cut out with my therapist. Also, economic reasons won't allow me to keep paying for therapy. Yeah, this is very unfortunate, and there's a lot of these things happening. It looks like the person underneath is actually given some advice of where to go. That's really good. This is, I think, the US. Psychology Today has resources for more affordable stuff, and openpathcollective.org. So these are low cost effective, but remember that unfortunately sometimes they won't cover it if it's not an emergency, or they're not going to cover it based on other things. However, it's important to know that every country has a suicide hotline. So if symptoms get bad enough and you're having a psychotic episode or severe emergency, not only can you go to the emergency room, and the emergency will always cover that, but you can also, for immediate mental health crises episodes, there are crisis phone lines that you can call. So that's important to know. It's rare, but not impossible. There was a person that developed schizophrenia when he was in his 60s. Absolutely, you can develop schizophrenia at really any age, but there are more common things. Auditory hallucinations aren't always a sign of psychotic disorders like schizophrenia. Sleep deprivation, for instance, can cause auditory hallucinations as well. Absolutely. Like other schizophrenia starts a bit younger. Usually you do have any other family history. No history of schizophrenia in my family that I know of, but definitely depression and anxiety. I wasn't aware that schizophrenia is very family, genetically associated, but that's a possibility. They started a month ago, and I have started switching from paroxetine to vortioxetine. Oh, interesting. Since paroxetine was sexually depriving me, now I feel paroxetine is not having much effect on me, and I'm back to being very depressed, angry, and volatile. Ooh, okay, I wasn't aware of that. So this person actually is having very severe, uncontrolled depression, in which case it's quite possible that some of these symptoms are actually side effect of severe depression. All right, guys, I hope this is helpful. Tell me a little bit about your experience. Tell me what you guys have, what questions you guys have, what medical question you have, where do you post, and let's all become more empowered to post about our medical issues, to get advice from fellow individuals online. Take care, guys.